In the new 2024 Maryland Medical Protocols, you will find two specific changes in the burn and carbon monoxide protocols for treatment of both pediatric and adult patients. Before we provide the updates, I wanted to take a moment to recognize that Maryland has 4 recognized burn centers located in Baltimore City and Washington, D.C. Children who have not yet reached their 15th birthday and who meet burn center criteria should be transported to one of the 2 pediatric burn centers: Johns Hopkins Children's Center, located on Orleans Street in Baltimore City, and Children's National Hospital, located on Michigan Avenue, Northwest in Washington, D.C. Patients 15 years of age and older who meet burn center criteria should be transported to one of the 2 adult burn centers: Johns Hopkins Bayview Medical Center, located on Eastern Avenue in Baltimore City, or MedStar Washington Hospital Center, located on Irving Street Northwest in Washington, D.C. The first update in the burn protocol focuses on the assessment method used to estimate percentage of burn area during an initial EMS care. You will see that the age-old rule of 9s has been removed for patients of all ages. The rule of 9s is difficult to use when burns are scattered, has even and odd percentages, making calculation an issue, and implies that all burned areas should be included. Quality improvement reviews in all Maryland EMS system burn centers have identified that most patients have at least 30% overestimation of total body surface area that is burned. The solution to these challenges is simple and patient-centered. The Palmer method provides a quick way to estimate the burn percentage. The surface of the patient's hand, including the palm and all 5 fingers, is approximately 1% of their body surface. There are 2 caveats when using the Palmer method. 1, use the patient's hand, not the clinician's, and don't laugh, it has been done in an emergency. And then 2, burn surface area used in the calculation should only include partial and full thickness burns, also known as 2nd and 3rd degree burns. In other words, superficial or 1st degree burns are not included in total body surface area estimates. Just to review, criteria for burn center transports includes: 1, all 3rd degree burns, this is full thickness. 2, 2nd degree burns or partial thickness that are greater than 10% BSA. 3, burns of the face, hands, feet, major joints, genitalia, and perineum. 4, electrical burns, including lightning or contact with high voltage. This is greater than 120 volts. 5, suspected airway burns associated with smoke inhalation. And 6 is circumferential burns involving the extremities or torso. A quick reminder about burn patients for our ALS clinicians. Fluid resuscitation should be considered only for burns greater than 20% BSA. Fluid administration must be calculated carefully for children and documented specifically for patients of all ages. While you will always remember the burn patients you cared for, they are infrequent compared to other transports. The burn center base stations are always available to provide medical consultation, including calculations of fluid based upon your burn assessment using the Palmer method. Scenario: you are caring for a 4-year-old patient who spilled hot liquids from a pot onto herself. The child is alert, crying in pain with an open airway, effective ventilation, and a rapid heartbeat. Vital signs are as follows: a blood pressure of 100/60, respiratory rate of 26, heart rate of 100, and a pulse ox of 96% on room air. She has burns with blistering on her right arm, right shoulder, right chest, and spots on her left foot. How would you estimate the total body surface area for this patient? A, the palm of the patient's hand, excluding the fingers, is 1% of their body surface area. B, the palm of the patient's hand, including the fingers, is 1% of their body surface. C, the palm of the clinician's hand, excluding the fingers, is 1% of the patient's body surface. D, the palm of the clinician's hand, including the fingers, is 1% of the patient's body surface. All burned areas, regardless of the size or degree, should be included in calculating the TBSA. A, true. B, false. The second update for burn patients is clarification in the overdose poisoning carbon monoxide exposure protocol. The most appropriate destination for patients with burns and/or smoke inhalation was clarified. Specifically, any patient with thermal burns that meet burn center referral criteria with or without smoke inhalation should be triaged and transported to a burn center. Adult and pediatric burn centers are prepared to treat both simultaneously. Adult and pediatric patients with suspected carbon monoxide poisoning from smoke inhalation should be transported to a hyperbaric center. However, if the patient also has thermal burns, including suspected airway burns, that patient should be transported to a burn center. There is no change in the transport decision for a patient with burns and trauma. These patients should be transported to the nearest appropriate trauma center. Children who have not yet reached their 15th birthday should be transported to a pediatric trauma center. In Maryland, both pediatric and adult burn centers are also trauma centers. You are treating a patient who was found by firefighters in a bathroom upstairs where she hid after trying to put out flames that were coming up the stairs from the kitchen. She appears to be in her mid-20s, is disoriented, and coughing up black mucus. She has thermal burns on both hands, right forearm, right foot, and her upper and lower right leg. Her vital signs are as follows: blood pressure of 140/80, respiratory rate of 12, heart rate 84, and pulse ox of 90%. Using the Palmer method, the estimated TBSA of second and third degree burns is 18 to 22%. She answers questions with single word responses and remains disoriented. She is able to move to the stretcher with assistance. What is the most appropriate transport destination for this patient? A, adult burn center. B, hyperbaric center. C, the nearest local hospital. And D, adult trauma center. You were on the scene of a house fire. Firefighters reported the fire was confined to the basement, but the entire house was filled with heavy smoke, and they found elevated CO levels of greater than 100 parts per million throughout the house. Your 85-year-old male patient was sleeping on the living room couch when the fire started. He did not wake up and exit the home until after fire and EMS services arrived on the scene. Your patient was not exposed to direct flames, and no burns were apparent on your exam. He denies any injuries but appears confused and is complaining of a headache with nausea, vomiting, and dizziness. What is the most appropriate transport destination for this patient? A, Adult Burn Center, B, Hyperbaric Center, C, the nearest local hospital, D, Adult Trauma Center.